from our foundational report, which laid out the basis for the digital healthcare transformation, or a DHT initiative that the forum is now leading, there are a few major findings that we identified through engaging with many dozens of experts from around the world in both the public and private sector in digital health and in healthcare. I think first is a sense of urgency. So that was something that came out very strongly. Digital healthcare transformation is a generational opportunity, yes, but it is also a critical necessity. So healthcare is, just to put out some thoughts that are very obvious, but people don't think about enough. Healthcare is a massive sector. So we're talking about more than 10% of the global economy, over $10 trillion in annual expenditure. And it's a central, aspect of life for 8 billion people. So the healthcare challenges the world is facing, like aging, chronic disease burden, and the deep inequity, are continuing to compound. And today's approaches can't solve today's problems, let alone tomorrow's problems. So the scaling of AI, digital health, and data-driven approaches must be a top priority for national governments driven by healthcare and technology leaders. So that's number one. We need more of a sense of urgency, and we need to move quickly to make this AI-enabled transformation a reality as quickly as possible in a responsible way. Second is that public-private collaboration will be absolutely essential. We're talking about the need for rapid innovation in a highly regulated sector in a very fragmented landscape. So transformation here will require even more coordination than in other sectors that have done digital transformation, like retail or banking. And each stakeholder in the health context will bring something to the table. So government has to facilitate a deliberate approach to development and funding of digital health strategies, digital health infrastructure, and the right regulatory and governance structures to create a strong foundation and enabling environment for AI and health. And so the World Health Organization, for example, is taking a leading role in this with the Global Initiative on Digital Health, working with national governments. Second, the private sector has to foster a vibrant innovation environment, which can then leverage this common architecture that government has helped to set. They have to then work to identify and scale the high-value innovations. At the same time, the private sector must adopt clear guiding principles on ethics, responsibility, and equity to ensure these innovations benefit everyone and are safe and effective. And then lastly, other stakeholders such as civil society, academia, patients, and providers, of course, play a key role in many ways by incubating new solutions, providing important feedback back to the innovation landscape, advocating for vulnerable and underserved groups, and providing a neutral basis for evidence and research generation. I think another insight is that this requires an ecosystem approach. So building off the prior comment, this is going to be a complex, major global transition that requires many elements working together over time. So there's no single silver bullet or unlock to make this happen. In our research, we laid out a strategic framework to enable digital transformation, AI transformation of health. This includes 5 major elements. So there's data, technology and analytics, funding and incentives, change management, and regulation and policy. So all of these elements need to be in place simultaneously, and this varies by geography and region, as every country's health system is different and are on different levels of digital maturity. And lastly, I would highlight the importance of leadership and inspiration, really. So given this will be a long, complex journey, the one thing we feel is very important is to catalyze progress by empowering leaders and decision makers. So by supporting willing leaders and providing the right tools and narratives, we can create a movement which is far bigger than any one digital or AI health tool. We have to build this collective will to scale AI and health. This can take many forms, including joint messaging and commitments, collaborative proof points or scalable projects, and lighthouses to serve as examples of what to do. So I think in summary, that's what I would say about some of the findings.